Which do you think would give you better protection from COVID-19? Natural immunity or vaccines? I'm going to talk about that in just a minute. But first, I want to thank you for coming to my channel, for watching my videos, for liking them, for commenting on them, for sharing them, and especially for subscribing to my channel. I'm amazed by the traffic that I get, and I'm thankful for every single one of you that has subscribed and that has come and watched my videos. Thank you very much. This came across my desk this morning, and I thought, well, this is interesting, but it's a news story, so let me check out the actual studies and see what they say. And there are actually two studies that have come out. This one is from Nature Journal, and these are both what they call them, peer-reviewed and accepted by the journals. So they are legitimate studies. And you can read through the details. I'll put the links in the description so you can look at them yourself in detail. But the abstracts will tell you what the study finds. And this study in Nature Journal says a large proportion of the world's population has some form of immunity against SARS-CoV-2 through either infection, natural, vaccination, or both, hybrid. This retrospective cohort study uses data on SARS-CoV-2 vaccination and hospitalization from National Health System from February 2020 to June 2022. This is in Estonia. And Cox regression modeling to compare those with natural immunity to those with no hybrid and vaccine immunity. In cohort 1, those with natural immunity were at a lower risk for infection during the Delta and higher risk during the Omicron period than those with no immunity. Natural immunity conferred substantial protection against COVID-19 hospitalization. Cohort 2, in comparison to natural immunity, hybrid immunity offered strong protection during the Delta, but not the Omicron, the same as those with natural immunity. Hospitalization was extremely rare among individuals with hybrid immunity. In cohort 3, individuals with vaccine-induced immunity were at higher risk than those with natural immunity for infection. Do you get that? The people who were vaccinated were at higher risk of infection than those with natural immunity. So, why did we spend billions and billions and billions of tax dollars, billions of tax dollars on vaccines that made the pharmaceutical companies rich and did us no good? Well, maybe it's because our government employees, Fauci et al., were constantly hammering into us that vaccination was the only way out of this pandemic. They basically lied to us. They did not know that for a fact, and now that we have research, we know that it's not true. This is from The Lancet, which is one of the most respected journals in the world. The SARS-CoV-2 pandemic is now better controlled in settings with access to fast and reliable testing and highly effective vaccination rollouts. Several studies have found that people who recovered from COVID-19 and tested seropositive for anti-SARS-CoV-2 antibodies have low rates of reinfection. There are still looming questions surrounding the strength and duration of such protection. We reviewed studies published in PubMed from inception to September 28, 2021, and found well-conducted biological studies showing protective immunity after infection. Furthermore, multiple epidemiological and clinical studies, including studies during the recent period of predominantly Delta variant transmission, found that the risk of repeat infection decreased by 80-5 to 100, so I guess it's 80.5 to 100% among those who had had COVID-19 previously. In other words, if you got infected once, you'll never get infected again. The reported studies were large and conducted throughout the world. Another laboratory-based study that analyzed the test results of 9,119 people with previous COVID-19 from December 1, 2019 to November 13, 2020 found that only 0.7% became reinfected. So we've learned a couple of things. Natural immunity is better than vaccine immunity. That's been proven now from the studies. And we wasted billions and billions and billions of dollars vaccinating people when it didn't do any good. Well, maybe I shouldn't say that. When it did some good, but not as much good as natural immunity would have. It's unbelievable. And we should never fall for this lie again, no matter what happens. We should understand that the human body is designed to fight back against disease. And then the other thing is, they lied to us about the treatments. Hydroxychloroquine combined with zinc and an antibiotic is highly effective against COVID. It can keep you out of the hospital and it can get rid of the disease. And ivermectin is also highly effective. And you remember all of the news reports where they ridiculed people trying ivermectin because it's horse medicine? Well, guess what? Animals get the same types of medicine we do. They just get it in much larger doses because they're larger beings. But the fact is that ivermectin is effective against COVID-19, and so is hydroxychloroquine combined with zinc and antibiotic. But no, they had to try and inject us with all kinds of vaccines and spend billions and billions and billions and billions and billions of our tax dollars and enrich the pharmaceutical companies because there's no way they could sell an over-the-counter cheap medicine that would cure us. That just wouldn't be right for the vaccine, for the pharmaceutical companies. So here we are, 3 years after the disease hit, and finally we're starting to learn the truth. And the truth is that we were lied to. We were lied to persistently, consistently, and repeatedly. The next time something like this happens, you should give that some serious thought and ask yourself, should I do what the government officials are telling me to do? Or should I do what I learned from God through prayer? My wife and I got vaccinated with the Johnson & Johnson vaccine because we were not going to use an experimental vaccine, mRNA. And we already know that the results of that have been negative for a lot of people. There's been a lot of adverse reactions, much more than what they're telling you. And I've quit taking the flu vaccine because I just started a regimen of taking quercetin, which is the same as hydroxychloroquine. It enables zinc to enter the cellular wall, and zinc and vitamin C every day. And I haven't been sick, and I'm not going to be sick because I understand what the mechanisms are that affect you when you're infected with a virus. And zinc is a virus killer. It's time for the medical community to admit that and to start figuring out regimens that will solve that problem, just like Dr. Zelenko did 3 years ago. As always, I pray that you will be abundant, that you will live a long life, and that you'll be healthy. And I pray that God will keep you safe from harm. I pray He'll do the same for every single person that you love. And I pray that you will be anxious for nothing, but in all things, through prayer and supplication, with thanksgiving, you will let your requests be made known to God. And the peace that passes all understanding will keep your heart and mind in Christ Jesus. This is the Vietnam Era Vet, out.